everyone. Well, I figured since it's Breast Cancer Awareness Month, I'll shed some light on what breast cancer truly is and ways to prevent it. Breast cancer is a malignant tumor that develops in the breast cells. There are two kinds of tumors, a malignant tumor and a benign tumor. Malignant tumor is a tumor that can grow into the other tissues and spread throughout the body. A benign tumor is a tumor that does not have the ability to spread, and that is why it's considered non-cancerous. Breast cancer usually begins as ductal carcinoma in situ, or DCIS, and I apologize because I'm pretty sure I said that wrong. DCIS is when the cancer cells have formed inside the breast ducts, but haven't yet spread to the fatty tissue. To get to the fatty tissue, the cancer has to break through the ducts. After it occurs, it starts to spread through other parts of the body through the lymphatic stream and the bloodstream. Lymphatic vessels are kind of like veins, except for they carry tissue waste products and immune system cells away from the areas that are infected. Lymphatic veins lead to the lymph nodes in the underarm area where lumps are usually formed. Breast cancer is the most common malignancy affecting women in North America and Europe. In 2001, 200,000 women were diagnosed with breast cancer. Breast cancer is right behind lung cancer and the leading cause of cancer death in American women. The risk of getting cancer is 1 in 8, and the lifetime risk of dying from breast cancer is much lower, which is 1 in 28. The increasing age is the biggest risk and a factor of developing breast cancer. As an aged woman, the risk of breast cancer increases. That is why at the age of 40, doctors recommend that women get mammograms annually. There are things you can do to prevent getting breast cancer, but if you have a family history of breast cancer, it's a little bit harder to control. You can avoid getting long-term hormone placement therapy, having children before the age of 30, and breastfeeding. Avoid gaining weight and limit your alcohol consumption to 1 glass or less a day. Women with family history can reduce the risk up to 50% by taking a drug called tamoxifen for 5 years. But it comes with some life-threatening side effects, such as blood clots, pulmonary embolisms, strokes, and uterine cancer. Another preventive step would be to get regular screenings. The earlier that breast cancer is detected, the easier it is to be cured. Screenings would be things such as mammograms, a clinical breast exam, and a self-breast exam. Between the ages of 20 and 39, women are recommended to have an exam every 3 years. But after the age of 30, you're supposed to have one every year. Every woman should self-breast exam every month just to be on the safe side, and you should be looking for lumps or thickening of the breast or underarm, changing in size or shape of breast, nipple discharge or nipples turning inward, redness scaling of the skin, ridges or pitting of the breast skin. Breast cancer can be treated with surgery, chemotherapy, radiotherapy, hormonal therapy, and biologic therapy. Every woman with breast cancer will have to do surgery during some time of your treatment. During surgery, the doctors try to take out as much cancer as possible. Patients are offered chemotherapy to decrease the chances of breast cancer returning. Chemotherapy is an anti-cancer drug that goes through the entire body to get rid of any other cancer cells that are left over from after the surgery. Radiotherapy, also known as radiation therapy, is the use of a high-energy X-ray that kills cancer cells. Patients usually have to get 6 weeks worth of treatment for this. Now, patients whose tumor expresses estrogen receptors are candidates for hormonal therapy with estrogen-blocking drugs. Estrogen-blocking drugs include the family of drugs called aromatase inhibitors. The tamoxifen also fits in this category. These drugs are a pill taken for 5 to 10 years after surgery. Biologic therapy uses a compound called herpestin, which is a substance that blocks receptors and helps to stop breast cancer from forming. Once a woman is treated for breast cancer, she is still closely followed. At the beginning, she has to go to follow-up visits every 3 to 4 months, and after time passes and the woman remains cancer-free, her follow-ups are less often. After 5 years, she only has to see her doctor once a year. I hope my speech gave you a better understanding of what breast cancer truly is. I know I learned a lot. Thank you for listening, and here is my audience. Thank you.